And welcome into another edition of WAJR's Ask the Experts. Thanks so much for being with us. I'm Tony Caridi, and today's program being brought to us in part by HealthWorks, Rehab, and Fitness. I am joined in studio by Sara Stepp and Dr. Ann Murray, and our topic today is physical therapy for neurological problems. Ladies, thanks so much for being with us. It's great to have you here.
Thanks for having us.
Thank you.
We'd like to talk about what is a very, very interesting topic that has truly undergone a revolution in the last 20 years. And so I think we should probably start at the beginning and define exactly what we're talking about when we talk about neurological problems. And so, Dr. Murray, if you want to start the process, when we describe that and say neurological problems, what are we talking about?
Yeah, I think it's a really broad term. I mean, I think that it can encompass things that, the run-of-the-mill neuropathies that lots of folks suffer with if they have longstanding diabetes, all the way to the other end of the spectrum of things that folks that have had stroke, that have epilepsy, that have Parkinson's or movement disorders. So we think about 1 in 6 people worldwide are affected by neurologic disease. So this is not unfamiliar territory. The biggest thing is getting the word out of saying, hey, we not only just can diagnose disease now, we can really start treating it, and we really want to get the word out on how we make folks' lives better, not just giving them a diagnosis, but getting them better, because it is affecting so many people.
Technology has been the biggest change. If you could, can you kind of give us a historical perspective as to, 50 years ago, someone, hey, that person has the shakes, to where we are today? What has happened to cause this evolution?
Yeah, I think one is the need has always been there. I mean, we'll often talk to families or patients, and they'll say, "Oh, my great grandmother had this, my grandmother had it, my mom or my dad had it, now I have it." So it's been affecting neurologic disease such as tremor or Parkinson's have been affecting folks for years and years. The big change has been that now with the advent of kind of newer medications, newer diagnostic approaches, as well as very fancy technologies, things like deep brain stimulation, high frequency ultrasound, the list goes on and on. But the point is we have lots of options now. We have lots of management choices. On top of all of that, it's also continually focused on just the idea of wellness, of exercise, of how day-to-day lifestyle changes can really change outcomes.
I guess it's now when you receive the diagnosis, it's no longer a sentence that does not have a potential positive result or a quality of life. Sara, I guess that's where HealthWorks comes in, because I think both of you would agree that in the past, when you thought about a neurological disease, physical therapy would not be part of that equation, and yet it is on a daily basis, right?
Very much so. So activity with these patients, for me particularly, I do a lot with patients with Parkinson's, is very important. Continuing to move, get out, be mobile, helps very much so with their strength, their range of motion. Not just that, but their confidence. I see a lot of patients who have a fear of falling and then they don't want to go out. Getting out there and being active is very important. I think that the research is showing, the minimum of 2.5 hours a day is what is good for these patients. So with, the treatment approach with me, they would get a minimum of 4 hours with me and then do more on their own. So it's just movement in general is very important. And now to have these specific approaches to treatment of diseases like Parkinson's is excellent.
Dr. Murray, I would imagine that as you have gone into this field, the biggest thing is that you're seeing is there's hope for people, and I would imagine you're getting a great deal of satisfaction knowing that there are options where in the past there weren't.
Guaranteed. I mean, absolutely. That's one of the most rewarding things out there. Neurologic disease, unlike a lot of things, is so physical. It impacts patients. They can see it. They can feel it. Not only can they see it and feel it, it affects their family. It affects their loved ones. It affects their interaction with the community. And I think that's part of my job is really relaying, well, what is this? But not stopping there. Really, that's the starting point. Really having the idea of, hey, we now know what this is. Now, what's the next step? What are we going to do about it? And that's where we have tremendous amount of hope now. And that's one of the biggest things that I would ever want to relay to our audience is to say, I know it can be scary. I know that it can be often even a certain stigma associated with neurologic disease. We want to break down those barriers. We want you to come in to see us. We're here to help you. We have lots and lots of options, but we got to start by starting with the conversation.
The one stat that you quoted earlier is pretty shocking. 1 out of 6 people at some point will have some form of neurological disease. So here's the question that can't be answered, but as basic as you can. Why do we have neurological problems? Why does that exist?
So I think the nervous system is probably one of the most sensitive systems, period, in the body from any kind of medical problem. So if we take diabetes, for instance, which is really common, affects lots and lots of, millions of people worldwide, diabetes has a tremendous or really takes a tremendous toll on the nervous system. If we take vitamin deficiencies, if we take traumatic injury, right? Lots of people can go out and have labor-intensive jobs and they get a traumatic injury. And more times than not, that traumatic injury is really going to result in a neurologic injury downstream. So we think that the nervous system is really just sensitive to anything that's going on in the body. It's one of the most sensitive things, and it shouldn't be any surprise to us that it really is a high degree of disease burden across our population.
We've got a lot to talk about. We'll get into some specifics as to how you can be helped. So if you or someone that you know is dealing with a neurological problem, we can help you out. The two ladies that you're listening to are Dr. Ann Murray and Sara Stepp, and they'll be hosting a free HealthWorks for You seminar coming up on Thursday night, October the 10th at HealthWorks Maple Drive location. It begins at 7 o'clock, and it again is free and open to the public, talking about treatment options using physical therapy and more for neurological problems. We'll talk more when we return. You're listening to WAJR's Ask the Experts.